The earlier the better. When it comes to discovering cancer, these are words to live by. Dr. Peraza has joined us here in the UH Broadcast Center to stress the importance of colon cancer screenings, and how these help with early detection and with saving lives. Dr. Peraza is a gastroenterologist at University Hospitals. So welcome to our show.
Thank you.
Colon cancer screenings can really make a difference in survival rates, correct?
That's correct. They reduce the mortality by about 50%. That's what the studies show.
That's fantastic. So tell us about the kind of screenings then that are available. There's different things you can do, right?
So there are three different modalities. One is the stool-based test, and the other one is your endoscopy, your colonoscopy and sigmoidoscopy. And then you have imaging techniques, including CT colonography and your pill colonoscopy.
Okay, so let's start with some of the easy ones, like the testing the stool. I guess is the easiest thing.
Yeah, that's easiest for the patient. So we have a few tests available. One is your fecal occult blood testing, the very popular FOBT, and the FIT testing, which is the fecal immunochemical testing. And then you have your stool DNA-based tests. So the stool DNA-based tests are more recent, and they have the most highest sensitivity for all the stool-based tests. And all these stool-based tests basically detect cancer or advanced adenomas, depending on what test you have. For colonoscopy and any kind of endoscopy, like sigmoidoscopy is a shorter scope. In the past, they used to do it just onto the left side of the colon, but there's a chance that you're missing lesions on the right side. So that's why it makes sense that we do a full colonoscopy. And when you do an endoscopy, you're also looking at the precancerous lesions. You're looking at them. You're working on it. You're removing those. And when you go to the imaging techniques, you still have to do the bowel prep. And then they basically look for polyps and any lesions. So those are the modalities. I mean,
that's what most people are familiar with, is a colonoscopy.
Right, right. And I think that makes the most sense because you're treating the lesions as well.
And if you do the occult blood stool, if there's something going on, you have to have the colonoscopy anyway, so you might as well go ahead and do it. And I think a lot of people are concerned about having one because of the preparation for it.
I agree. That's what I tell my patients as well. The hardest part of the test is the colonoscopy prep. It's things have improved over many years. In the past, we just had one option that's like a gallon of Golightly that you drink every 10 minutes, starting the night before. But now we have smaller volume preps. But regardless, you'll still go to the bathroom the same. That's what I say, because you have to clean out your colon. And that's the most important part of a colonoscopy, because we want to make sure we're not missing any lesions when we do that.
Right. You don't want any stuff in there.
Right. We don't want any stuff in there.
All right. So when should people start getting colonoscopies?
So the average risk adult, it's recommended by most of the societies to get started at age 50. For African Americans, it's about 45 by the ACG guidelines.
Okay. If there's family histories, is that different?
So if you have a family history, again, depending on which kind of cancers they have and when they had it, it should be at least 10 years prior to the earliest family member having colon cancer, or at age 40. But again, if you have certain kind of familial syndromes, like polyposis syndromes, then it's much earlier, and you obviously will talk to your gastroenterologist.
Okay. Don't wait for something to happen. Get those screenings, right?
That's correct.
All right. So odds are a colonoscopy will find polyps before they're cancerous. So the odds are in your favor, so you got to get screened. Why, thanks to Dr. Peraza for alerting us to the importance of colon cancer screenings. Thank you.
Thank you.
For more information, call the Center for Lifelong Health at University Hospitals at 844-312-LIFE-5433 or log on to www.uhhospitals.org/lifelonghealth. Next,